morning everyone. We will continue our class of amenorrhea. Today we will see secondary amenorrhea. Secondary amenorrhea is absence of menstruation for 6 months or more than 6 months is secondary amenorrhea. So absence of menstruation for 6 months or more in a female who had already menstruated previously is secondary amenorrhea. Now, etiological factors, we can see tubercular endometritis. In this, there will be destruction of endometrium and there will be adhesion formation because of the adhesion formation is because of tubercular toxin, and this adhesion will cause amenorrhea. Again, post radiation is the cause. Syncytial formation, surgical removal of the endometrium by laser or any ablation will cause amenorrhea. So basically there will be destruction of endometrium and that is the cause of amenorrhea. Ovarian factors like PCOD, which is very common. So in PCOD there will be LH level will be raised, and proper ovulation will not be there. So ovulation will not be there, and this is the reason for amenorrhea. Again, premature ovarian failure because of the absence of follicle. There will be accelerated depletion of the follicles in the ovaries, and there will be prematurely ovarian failure will develop, and that will cause amenorrhea. Resistant ovarian syndrome, also called as SHABNAM syndrome. Here the follicles are present but are resistant to gonadotropins like FSH and LH. So here there will be defect in the FSH receptors over the follicles. So receptors will not be either present or they will be not be sensitive for this FSH, and that's why there will be the ovaries will be resistant, and because of this ovulation will not be there. This will cause amenorrhea. Again, hyperestrogenic state like persistent follicles in metropathy hemorrhagica. Here the estrogen levels will continuously high and there will not be any progesterone secretion, and because of this there will be hypertrophy of endometrium, and the menses will not come on properly. Again, feminizing tumors like granulosa cell tumor might be the reason for amenorrhea. Again, masculinizing tumor of the ovary. Here the androgen will be excess, and that will oppose the effect of estrogen on the endometrium, so there will not be any proliferative effect, and that will result in amenorrhea. Again, hypoestrogenic state like ablation of ovaries and pelvic radiation. This will cause the removal of the site of the production of estrogen. Basically follicular development will not be there, and that will cause amenorrhea, or it may make the ovaries unresponsive to the gonadotropins, and that will lead to amenorrhea. Again, pituitary factors, here pituitary adenoma, Cushing syndrome, acromegaly, all these are the reason which will cause hyperprolactinemia, that will inhibit the ovarian steroidogenesis, means production of this estrogen and progesterone, and that will cause amenorrhea. Sheehan syndrome, here complete or partial destruction of the pituitary gland will be there, and that is caused by venous thrombosis because of the PPH, and that may lead to amenorrhea. Again, Simon disease is one of the cause for amenorrhea, and basically that will affect the growth hormone and gonadotropins. Again, it may affect thyroid stimulating hormone and prolactin, which may lead to amenorrhea. Hypothalamic factors, here psychogenic shock, stress in anorexia nervosa, pseudocyesis, that might cause amenorrhea. Here the estrogen level will be low, and LH and FSH level remains generally normal. Again, congenital malformation of the ovaries, trauma, any infection, and tumors like craniopharyngioma or meningiomas may lead to this amenorrhea. Adrenal factors like adrenal hyperplasia and Cushing syndrome. So here there will be testosterone will be excess, that will cause the estrogen effect will be minimized because of the excessive testosterone, and that may lead to amenorrhea. Thyroid factors, generally hypothyroidism is the condition where the raised thyroid stimulating hormone will be there, and that may have effect on the thyroid releasing hormone, that will have impact on the pituitary gland, which will lead to GnRH secretion will not be there, so that will lead to amenorrhea. Again, general disease like malnutrition, tuberculosis, diabetes, chronic nephritis, that will disturb HPO axis and will lead to amenorrhea. Iatrogenic causes like contraceptive pills, psychotropic factors, again various antidepressant drugs, antihypertensive drugs that may lead to amenorrhea. So common cause of secondary amenorrhea is stress, and that stress will generally cause PCOD, and this is the commonest reason for secondary amenorrhea. Post pill amenorrhea might be there, and so contraceptive pills the patient is taking, and after stoppage of the pill the patient may suffer from amenorrhea. Sudden change in the weight, generally loss of weight or gain of weight might be the reason. Antihypertensive and psychotropic drugs are the also the cause for the amenorrhea. In diseases like hypothyroidism is common, premature ovarian failure and PCOD is common. Synec formation, that is tuberculous endometritis, is also the reason for secondary amenorrhea. So investigation point of view, progesterone challenge test is important. TSH level it has to be looked for. Again, hormones should be looked for the thyroid level like hypothyroidism and pituitary adenoma. Progesterone challenge test is important. Here withdrawal bleeding, if at all is present, then HPO axis is intact, and the reason generally PCOD. If at all withdrawal bleeding is absent, then there will be receptors for the progesterone are absent or less, and estrogen progesterone challenge test combined has to be done. If at all bleeding is not present, then Synec formation has to be ruled out. If at all bleeding is present, then FSH and LH level has to be estimated and PCOD has to be ruled out. So here estimation of FSH and LH level has to be done, and if at all these levels are high, then karyotyping has to be done. If at all the level of FSH and LH is low, then hypothalamic hypothalamic pituitary ovarian axis has to be looked for, and if at all pituitary lesion is there, that has to be like craniopharyngioma has to be assessed. So this is about the secondary amenorrhea. If at all you are having any query, mention in the comment box. I will try to solve it. Thank you.